Good afternoon. Don't go yet. We get to talk more about healthcare. And as a higher education professional turned healthcare professional, I'm really excited about this next conversation. Today, we've already talked about a number of statewide programs and initiatives to address workforce preparedness across the board. But now for our last panel and discussion of the day, we get to gain a little bit more perspective on addressing our workforce preparedness for one of our highest demand and fastest growing industries, and that's healthcare. To discuss this further, I'm happy to welcome on the stage with me Neil Pruitt, Chairman and CEO of Pruitt Healthcare and our 2024 immediate past Chairman of the Georgia Chamber of Commerce. Welcome. And Dr. Jonathan Murrow, Associate Campus Dean for Research, Augusta University and the University of Georgia Medical Partnership. Welcome. Good afternoon.
Thank you.
Neil, I'm going to start with you. I think we both know that the need for healthcare professionals was really critical even before the pandemic, and then the pandemic exacerbated that. We looked at in the Healthcare Commission that the governor started a year or two ago, the aging population of Georgia and how that's also contributing to the need for healthcare professionals. In your eyes, what are the top needs and trends you've seen kind of in your role related to healthcare professionals, and what do you see kind of as the greatest challenge to really finding that talent?
Well, thank you for having me. It's a pleasure to be here. We all know that healthcare workforce is a big problem, not only for my particular industry, but for our state. During the pandemic, we were adequately staffed, but overnight it changed. If you think about what happened during the pandemic, a lot of our workforce are in their 50s, late 50s, maybe even early 60s. They are a second wage earner. And the first thing that happened during COVID, if they had any comorbidities with their health whatsoever, is they left the workforce. One, because they feared for their own safety, and two, because a lot of the economy was closed at that juncture and government programs came in and it made them where they didn't have to work to provide for their family because the primary wage earner was doing so. And so fast forward, the state of Georgia came in and was a great help with some of our agency staffing to meet our short-term needs. And it's easy to Monday quarterback that, but what really happened during that time period is a lot of nurses in the state of Georgia went to work for these temporary staffing agencies. And what that meant is we had less full-time workers working for healthcare, providing care for the roughly 23,000 patients we serve on any given day. And that's a problem from a quality of care standpoint because you want consistent staff delivering consistent quality of care. Now let's fast forward. At the same time, we as a state have not been providing or planning adequately to train nurses and physicians. And I'm sure Dr. Murrow will get into this, but the amount of physicians that we produce per 100,000 med students, there's only 41 states in the country and we're dead last. There's 30,000 vacancies in the healthcare profession today, and that's going to grow to 100,000 by the year 2030. At Pruitt Health, during the pandemic, we had 5,000 open clinical positions. Now that's out of about 10,000, right? And so we're now down to 500 open positions. That shows that things are improving, but we aren't there yet. We need longer-term solutions for the workforce. We need to incent our young people who happen. I saw all of them left when we started talking about healthcare, but we need to get them engaged and fired up to provide for our citizens, especially the elderly.
Thank you. I think you're spot on. I think we know that one of those longer-term solutions we need to focus on is that pipeline within the educational system. Dr. Murrow, we just heard in the previous panel, kudos to Governor Kemp, and we heard Chancellor Pruitt talk about the investments that are being planned for both the new medical college at the University of Georgia and a new dental school at Georgia Southern. Within your role, can you share some insights on what capacity and planning efforts look like on the new medical college?
Sure, I'm very excited to be here, and for me personally, it's been about 15 years of in my career to get to this point, partly because I'm from the Athens area. My wife and I, we went off to school, came back, she's a physician too, and we said, well, Athens would just be perfect if we just had a medical school there. So over the past 14 years, we've both been part of that faculty at the branch campus of the Medical College of Georgia to get us ready to have an independent medical school at the University of Georgia. The University of Georgia is very proud of the impact it has on this state. I think there's probably some dogs here in the audience. But with that, the impact on teaching useful skills to students, developing new knowledge that helps Georgia, and also service. Those are the three parts of that. And if you really think about what this medical campus, this independent medical school is going to do in Athens, it's each one of those things. For those who may or may not be familiar with how medical school training goes, after college, there's a 4-year program to get your MD degree. The first 2 years you spend in the classroom or learning more of the basic foundational knowledge, and the last 2 years you spend in a clinical setting working with pediatricians and surgeons and internists or cardiologists like myself, trying to sort out what kind of practice you want to have. So what we are doing in Athens is taking the success we've had as a branch campus of the Medical College of Georgia and laying the groundwork for the next phase of what's to come. So we're looking forward to, we're aiming for a target of 2026 to get our first class enrolled. We're going to start with the same class size we have now, which is 60 students per year. It's a 4-year program now, so we'll be working towards developing the clinical rotations and continuing to expand those with an eye towards expanding our class size to 72 at some point, and then at one point to 120. So big changes to come, but we're very excited to be able to make these things, and very thankful to the Chancellor, to Regent Pruitt, and all the support we've gotten from the Governor as well.
Well, we certainly appreciate that effort and look forward to continuing partnerships with you on how we find faculty and all the other things that need to go to support that. Neil, you do serve as a regent with the Board of Regents. Can you talk a little bit about your perspective on this investment and others within the university system and how it kind of all fits together with everything that the university system is doing to improve the healthcare workforce?
Sure, absolutely. Chairman Reynolds, who's chair of the Board of Regents, created a work group, which I chaired, that looked at the UGA Independent Medical School as well as nursing programs throughout the state. And we've come to the conclusion, building on some of the work that was done with DCH and the workforce preparedness study they did, and we actually brought in a consultant, eccentric consultants, to help us look at it. We know that there's a lot more that needs to be done. But I tell you what I'm really excited about is our partnership at the Gold Dome. If you look at the amount of money that was put in to support medical education, it's really astounding. $50 million for the University of Georgia. $178 million for a dental school at Georgia Southern. That's on top of the previous session putting money into renovating the building to house some additional medical school at the Armstrong campus. So while I too am very excited about the UGA Medical School, this is 1 + 1 = 3. Those 60 slots that are there now will be moved essentially over time to Savannah to be replaced by 120 slots. That means we have a net gain of 120. Our issue now that we need to work on is what Dr. Murrow referred to as the graduate medical education. So we started what was called the GREAT Initiative back in 2013, was to expand GME slots. And we were very successful. To give you an idea, the training that he talked about before we started this initiative to get new programs up and running through what they call virgin hospitals or residency naive hospitals. Maybe virgin hospitals is not politically correct, but that's what I've always heard it called. And I believe, Dr. Murrow, you were involved in setting one of those up. So we expand the slots. So before we started that, it was 1.8 slots to every one medical student. And then we moved to 1-to-1 at the conclusion of our work. But we really need to be about 1.2 to 1. So while I'm very excited about what our partnership across the street has done and what we've been able to create in terms of our human health infrastructure and training our students and making sure we have a world-class healthcare system to match our #1 place to do business achievement, there's a lot of work to be done. So while I'm very excited about what we're starting, this is just the beginning of a long process.
Definitely agreed. Definitely agreed that more conversation around GME to come. Dr. Murrow, you're consistently, I'm sure, hearing from students about their needs and their career plans. What are some of those biggest takeaways about what students at our institutions need to be prepared to engage in careers in healthcare? And then maybe what are some of the biggest challenges that our institutions are facing as they try to prepare those students?
So if I think about the role I'm in now as an educator, it's really focused on the training physicians. But in my other role, I'm in practice as a cardiologist. And so if I'm on call at the hospital in Athens taking care of someone who comes in with a heart attack. Well, I'm just one part of that team. By myself, I can't take care of that patient unless I have help from nurses, nurse practitioners, ultrasound technicians, x-ray technicians, phlebotomists, cath lab techs. All of those folks are part of the team. And so part of what I think is a challenge for our education system is trying to sort out for those students who have a passion for healthcare, where do they fit in that team? You know, the way of growing and solving, or at least addressing our healthcare workforce issues, is to really be mindful of that pipeline early on for all of these folks who could wind up working in some healthcare role, whether or not the right fit is in as an MD, or is it one of other roles that I've just described. That's a big effort that educators here at all levels can really be thinking. You know, how do you identify those students who have a passion for helping, passion for science and for caring? Those are the two things that are really the core part of healthcare, and give them exposure, give them some role models, and ask them, why not? Why not should I go after this nursing degree? Why not should I go after this advanced practice provider degree? But the two parts of it are tough as well, is we have to recognize that in healthcare especially, the workforce it's work. There's a lot of rigorous effort that goes into training the folks that we want taking care of us. And recognizing that and just saying it's going to be a lot of work without taking care of our students and understanding the toll it has on them over time of just trying to help other people and seeing the suffering they go through, we'd really be not doing a good service. And I think we've gotten a lot more mindful of that over the past several years. Certainly the pandemic and other things have made us really think we got to figure out who's going to do this work, who's capable of doing the work, but we got to really give them the support and take care of our students.
Thank you.
Sure.
As we look to the future, I think it's certain, we all know the healthcare industry is going to continue to evolve to kind of meet both the needs of our patients and healthcare providers with new technologies. I'd love kind of both of your insights as how best you feel that private industry can partner with our higher education institutions to build relationships to ensure that our students really are prepared to be engaged and effective practitioners in Georgia.
Well, I can start. I think that what we did with our partnership with WellStar, with the former AU Health, is a good example of private enterprise and government working together. You know, from the Board of Regents standpoint, we realized, and I served on that board forever, is we're never going to be big enough and have the economies of scale it takes to compete in today's healthcare environment. And so what we did from the Board of Regents standpoint, it was we partner with a proven provider so that we can have a world-class clinical platform in Augusta to train our students. And I think that's a model going forward. So whether UGA picks a partner or a couple of partners, if we can have those type of partnerships, it's really going to provide resources, and it's going to provide a good training ground for our students. Another example is Albany with the technical school. Phoebe Punny is building a nursing school right on the campus so that they can have their students right by where they eventually, hopefully, will be offered a job. And that's creative. But there's only a couple of examples. We need to replicate those examples across the state. And I think that by really leveraging those partnerships, we really can increase the workforce that's out there. As far as technology, which is interesting, and this is just something that blows my mind with government, is we've made a lot of advances, and COVID really spurred our industry, especially my industry, because we didn't have a lot of technology, to really up our game. We accomplished more in 3 years than we did the previous 15 years. And so now, for just an example, the telemetry machines that you see at the bedside now will go directly into our medical chart. We've decreased administrative time for our nurses by about 20%. So while we've made all these advances, the federal government, in their infinite wisdom, has come down and said we want to mandate minimum staffing requirements that are well above what anyone in the state of Georgia is practicing in long-term care. Now, you may say, well, that's great. There's going to be more people taking care of mom and dad. But just for the exact reasons that I just went through, there's not enough staff to do it. And more importantly, the government's not willing to pay for it. So while we have all these creative partnerships at a state level we're looking at a federal policy that really is aimed at depleting the resources of organizations, which stifles creativity and stifles ultimately the quality of care that we deliver at the bedside.
Thank you. Dr. Murrow?
I'll expand on the question about where these students are going to learn medicine, where these patients are going to be, where they can learn the skills of how to examine, make a diagnosis, learn how to do basic procedures. And that's really the clinical learning environment is what we call that. And so the hospitals that accommodate students now, at least in Athens, 15 years ago, none of the two hospitals in Athens were not teaching hospitals. Now both of them are, and both of them have residency programs that not only have undergraduate medical students there, they have folks with MD degrees who are also now training to be internists. And so every year out of Athens, there are 40 graduates that are ready to practice medicine. Those partnerships are crucial, and to echo the arrangement now with Augusta and Wellstar, it certainly is not necessarily not critical for the university system to own that hospital. There's plenty of opportunities for these hospitals that are not teaching hospitals, if there's not, to become one, and to provide that environment where these students can learn. Now, what's the benefit to those hospitals? It certainly enhances the quality of care. That's been shown over and over. Even though you would think you have a less experienced person involved in the care, they're much more diligent about decisions made, maybe even much more up to date on the technology and the practice guidelines. And certainly, from a recruiting standpoint, those hospitals that have hosted these residency programs have really enjoyed the ability to have them stay on as faculty, stay on as their staff, and join the program without having to hire a recruiter and all those other things to bring them to town. So all of those are really some nice, maybe you can speak to that too as part of the hospital.
Neil, were you going to add something?
Well, I was just going to add, because it's a very important point, is that when we don't have enough residency slots to train our students in our state, they go elsewhere. And they go to other states. And so what happens when you go to other states? You may fall in love, you may get married, you may find the perfect job, you don't come back to Georgia. And so while we're training the students, if we don't have that secondary tier, we aren't going to be successful. So what Dr. Moore was alluding to, what I was alluding to, is we really have to tackle this issue. That if we really want to make progress, we have to be able to train our students in the state, and particularly in rural areas, because that's where we have problems, right? So if you think about it, there's like I said, there's 19 counties in the state of Georgia without a physician. There's 9 without a physician, there's 18 without a family medical practice, and there's 40 without internal medicine. I mean, that's unacceptable for a state like ours, and we really need to attack the problem.
Yeah, I was just going to add, I think there's some research, I don't know the exact number off the top of my head, but that proves that residents most often choose to stay and practice full-time after the residency within like a 10-mile radius of where they complete their residency. So that's really, really critical. We're a little bit ahead of time, so if Daniela doesn't object, I might ad-lib. We've talked a little bit about healthcare and the folks on the front line providing bedside care, but speaking to a room full of educators and folks interested in that, maybe, Neil, can you talk a little bit about the rest of the team that it takes to run a healthcare facility and how, especially our high school students and folks coming through the technical colleges, might be able to fill a role in those back office positions that you have to have?
Absolutely. We've talked a lot about nurses, and there's always a great partnership out there is training folks to be certified nursing aides or CNAs. And what a lot of time they come in, it's a certification process. They have to be trained extensively, but that's a stepping stone, right? So they can go back to school, become LPNs. From there, they can go on and get an RN and even advanced practice. So we have a number of our partners that have been able to do that. But it takes a lot to do what we do every day. And there's no one person that's more important than the other. You know, whether you are helping clean the floors, doing laundry, providing meals. In our organization, we service over 18,000 meals a day. And so we are a hospitality industry. And then regulated by the government, we have a whole team that complies with federal and state regulations. And so it's important that we help develop the workforce for all these positions. And I think we do that by creating career paths, like I mentioned with CNAs. Or if you go into housekeeping, you want to go to nursing school, is there a way to do that? And if we look at why a lot of the people choose not to do it, it's the wraparound services around going to nursing school or becoming a physician. A lot of them are lower income, means they don't have childcare, they may not have the right housing. So, if we're going to tackle the problem, we have to look at it holistically. So for the educators in the room, I would encourage you not only to educate the students, but again, partner with private enterprise to see how we can provide those wraparound services and make sure that our students are successful.
Thank you. I just want to put in a plug, too. In this year's budget, Governor Kemp, in his wisdom and leadership, included language within the technical college system's budget for a quick start for healthcare-like or similar type of program that would actually provide some technical assistance to communities around the state to build these real partnerships and pathways between K through 12, the technical colleges, the university systems. There's some really good examples out there, especially some in Southwest Georgia and down on the coast, and some funding to actually hire some folks that would help go into communities, assess their need, and help them kind of, what some of those comments we saw, somebody to lead those conversations to build those paths. So really excited to see that. Dr. Murrow, any kind of parting thoughts from you?
Yeah, I think we're just in a great spot to build Georgia's future with healthcare. We've done a lot of efforts during the time that, growing up here, we've been successful in attracting a lot of folks to want to live in Georgia. I mean, I think half the people who now live in Georgia they weren't born in Georgia. So something we're doing continues to be attractive, which tells me that really we can lead the way, but yet we've got to address the healthcare issue to continue to be desirable place for people to come to. I think a lot of the ways things were done in the past aren't the ways we're going to get things done in the future. These partnerships we've just talked about are a great example of things that work well for industry. I mean, healthcare is a big industry and it's expensive. We've got to figure out how to get those costs addressed and deliver better care. There's no one here that healthcare won't impact as much as we like to think about it. Don't like to think about it. So, but I'm excited that we're positioned to do the things we're going to be doing the next decade.
Thank you. Y'all want us to take a few questions? We're wrapping it up? We're good. Here says we're good. Well, thank you both for your participation, especially want to thank Chancellor Perdue, the full Board of Regents, Governor Kemp for their leadership and investment in both the new medical college at UGA and the new dental school at Georgia Southern. We're just excited and appreciative of those efforts and look forward to seeing those come online to serve our students and Georgians in the future. So thank you. I think we'll turn it back to our president, Chris Clark.